Did you know that there are some particular days in your menstrual cycle when your chances of becoming pregnant is very, very, very high? Yes, this is called the fertile period and happens when your ovary releases an egg. In this video, let us look at what is this fertile period and how can you measure and find out what is this fertile period or what are your fertile days to increase your chances of becoming pregnant. Hi, I am Saranya, a birth professional and a life coach for pregnant women and the founder of Babypedia. What is this fertile period or fertile days? Well, it is usually a couple of days before and the day after you ovulate. Ovulate is when your ovaries, you have two ovaries. There's a right ovary and a left ovary. So every cycle, one ovary will release a mature egg. So when this ovary releases a mature egg, you ovulate, or this process is called ovulation. So now the lifespan of an egg is 24 hours, whereas the lifespan of a sperm can be anywhere from 3 to 5 days. So that is why we say 2 to 3 days before you ovulate. Even from that time, if you have intercourse or sex, this sperm can live inside your body, inside your uterus or your cervix, waiting for the egg to be released. And as soon as the egg is released, the sperm can fertilize the egg. So if you have intercourse 2 to 3 days before you ovulate, till 24 hours after you ovulate, there is a high chance that you become pregnant because the egg is there, the egg is getting released, and the sperm is readily there, or the sperm is also getting released within, a few hours after you ovulate. So when both are already ready, there's a very high chance that fertilization will take place, and bingo, you will get pregnant. Now, how do you find out what these fertile days are or when you ovulate? Now, usually if you have an average cycle, menstrual cycle of 28 to 30 days, a lot of experts will tell you that you can ovulate anywhere from the 14th day to the 18th day. So now this can vary for woman to woman. We now know that ovulation can change even if you have a pakka 28 to 30 day cycle, or even if you have irregular periods, then your ovulation day can change. Now your ovulation will change based on multiple factors. Okay, it's based on your sleep, it's based on your food and lifestyle. It can change based on your stress levels. So women who are highly stressed, they can ovulate a little early in their menstrual cycle, or they can ovulate very late, even a few days before they get their periods. Okay, so that is why we say sometimes measuring the 14th to 18th day may not be a very reliable way of finding out when you ovulate. So what are the other methods of finding out when you ovulate? The easiest is look at your body, observe all the changes that are happening in your body. Your body is the best cue for you to find out when you ovulate. Now, what are the things that you have to notice in your body? There are a couple, like finding out your basal body temperature, checking your cervical mucus and the changes that happen in your mucus, and you could also find out by using a ovulation kit. So these are just some of the ways in which you can check your body and find out when you are ovulating. Now let us look at basal body temperature. Now how do you find out about the when you are ovulating using this method? Now for the basal body temperature, every morning as soon as you wake up, you don't get out of bed, you don't go urinate, you don't brush your teeth, you don't drink water, nothing. The minute you wake up, you're still lying down in bed and you measure your body's temperature. Okay, so from the day that you got your periods, slowly start measuring your temperature every day and note it down in a diary. It could be digital or a notebook. Keep it at your bedside, or you can note it in your phone. But every day note the temperature at which your body is when you wake up. Now, slowly a day or two before you ovulate, your temperature will spike. It will spike till the day after you ovulate, and then it will slowly start reducing. So when you start checking for a month, 2 months, 3 months, you will slowly start understanding the spike in your temperature, and you know those are the days when you ovulate. So this spike is not going to be very much, very drastic. It's just zero 0.5 to 1 Celsius. Okay, just 0.5 to 1 degree Celsius will be the spike. So that is why you have to note it every day. And when you see that spike happening, that 0.5 degrees on the day before you ovulate or a few days before you ovulate, then you can start planning your intercourse days. Okay, so when you have intercourse in those days based on your basal body temperature, when it starts spiking, you know that you are having intercourse when you are ovulating, you have found your fertile days. Nowadays in the market, you also find these basal body thermometers that you can buy and use. If you find measuring your temperature every day on a regular thermometer is a little difficult for you. Okay. Now, the second way in which you can find out whether you are ovulating is by checking your cervical mucus, or what we usually call as the vaginal discharge. So this discharge that we usually experience in between our menstrual cycle is from the cervix and from the vaginal glands. So usually after your periods get over, your bleeding stops. It's a little dry. You don't have much of a discharge, right? But as the days progress and you are nearing ovulation, the amount of discharge that you experience will slowly keep increasing. It can become very watery and the quantity could also be a little high. Now, when you are ovulating, when you look at your cervix, you check, you can take the cervix and you can just elongate it between your two fingers. It'll be a little sticky and it'll be like an egg white consistency, okay, transparent egg white consistency. So when you pull your fingers like this, it will stretch. When you have this stretchy egg white consistency discharge, you know that you are ovulating. This is your fertile period. So then plan your intercourse accordingly based on your cervical mucus. And after your ovulation gets over, again your discharge will become a little thicker and then it will slowly become scant for some other or some women. For others, it can just be a little thick until you get your periods. Okay. And another way of finding out when you are nearing ovulation or ovulating is by checking your cervix. So what is a cervix? This is the mouth of the uterus. So it is a little above your vagina. So your doctor will usually do a vaginal exam. They will insert their fingers and they will check how your cervix feels. You could also do it at home if you feel comfortable enough, but ensure that your hands are very clean. You have cut your nails so that you do not hurt yourself. And with very clean hands, you will have to touch your cervix and see. So insert your hands into your vagina and slowly go till you poke against something. Okay, that is your cervix. So examine, touch and feel and see how the cervix is. Before you ovulate on any other normal day, your cervix will be hard, it will be more closed and it will be further behind, it will be up. But nearing your ovulation and on the day that you ovulate, your cervix will slowly come down, it will become very soft and it will open up a little. This is to facilitate or make it easy for the sperm to enter into the uterus through the cervix and go meet the egg and get fertilized. Okay. So now if you can keep checking for a couple of cycles, you will totally see the difference in how your cervix feels. It'll be a little lower so you don't have to insert too much of your finger inside. So if you feel that your cervix has become softer, it's a little more below downwards and it is a little open, then you know that you are ovulating. So then you can plan your intercourse on such days when you know that you are ovulating. There are also ovulation kits that you can get in the market. Just like how you have your pregnancy kits, you just have to check your urine in the morning and the kit will tell you whether you are nearing your ovulation, whether you're ovulating or you are not ovulating. So this is one of the easiest methods that you can use to predict your ovulation dates. Now that we have given you, you know what is called fertile days, what are the best days to become pregnant, and you know the different ways in which you can find out the signs of ovulation. Go ahead, start planning, choose any one or even two ways to find out when you are ovulating and make use of it to ensure the highest chances of getting pregnant. All the very best and my prior congratulations on your pregnancy. Take care. I will see you soon in another interesting video. Till then, don't forget to like, share it with another person who will benefit from watching this video and subscribe to the channel to get much more interesting information like this one. Take care. I will see you soon. This is Saranya.